What if I told you the entire nutrition system, from your doctor's advice to school lunch menus, was built on religious visions and cereal company profits, not science? Today, I'll show you how meat was demonized, low carb was buried, and the grain based lie became the law of the land. Hi everyone, I'm Mark Bates. I'm a metabolic health coach, and this is part of my question and answer series. Exposed: How Big Food and Religion Hijacked Our Nutrition Guidelines. Let's get to the question. You mentioned that the American Dietetic Association was financially tied to Kellogg's and Sanitarium while defending grains and dismissing animal based therapies. How exactly did these corporate religious partnerships function to suppress contradictory research? What were the specific mechanisms they used to bury or misrepresent low carb trials that challenged their narrative? Very fundamental question. The suppression of low carb, animal based therapies in favor of plant based, grain heavy dietary guidelines involved a well organized alliance between the Seventh day Adventist Church and their religious ideology and corporate partners who typically were processed food industry, especially Kellogg's and Sanitarium. These groups leveraged institutional control over education, research funding, media narratives, and policy advisory boards to ensure their ideology prevailed even when scientific evidence contradicted it. Here's how these mechanisms functioned in practice. Start with institutional capture. You need to control the dietetic education. So, founding the American Dietetic Association, the ADA, were Linda Francis Cooper, trained at Harvey Kellogg's Adventist-run Battle Creek Sanitarium, and co-founded the ADA in 1917. For 30 years, all major dietetic textbooks in U.S. medical training were authored by Adventist-trained dietitians, promoting a vegetarian grain-based diet as healthy eating. This meant future dietitians entering the profession already believing meat was harmful, without exposure to data showing low-carb benefits for diabetes and metabolic disease.